Week 11 at the Georgia Capitol brought major developments as lawmakers raced toward the end of the legislative session. The Georgia Senate passed its version of the fiscal year 2027 state budget, setting up final negotiations with the House just days before Sine Die. This budget outlines how the state will fund health care, workforce programs, and critical services starting July 1st, and the Senate made some significant changes. The biggest headline: a historic investment in services for Georgians with intellectual and developmental disabilities. The Senate added funding for more than 1,200 new home and community-based waiver slots, a major increase compared to earlier proposals. These waivers help people receive care in their homes instead of institutional settings, though thousands remain on the wait list. The Senate also reshaped Medicaid provider rate increases. While some services, like primary care and autism services, would see higher payments, other areas were cut, including funding tied to mental health treatment facilities and supports for families caring for children with autism. On the workforce side, lawmakers took a different approach. The Senate reduced funding for some medical residency programs and rural training efforts, while adding a new family medicine residency program, reflecting a shift in how the state is addressing provider shortages. There were also notable changes to maternal and rural health investments. The Senate scaled back expansion of maternal home visiting programs and removed several House proposals aimed at strengthening rural hospital infrastructure, raising concerns about access to care in underserved communities. Meanwhile, decisions around Georgia's insurance market could have long-term impacts. Lawmakers kept a reduction in funding for the state's reinsurance program, a move that could affect premium stability, especially as enrollment in Georgia Access faces uncertainty. Now the House and Senate must come together to finalize a budget before the legislative session ends. If they don't reach an agreement, lawmakers may need to return for a special session to complete this required work. Beyond the budget, several key health bills are still in motion, including efforts to expand access to HIV prevention, strengthen the healthcare workforce, and improve protections for patients facing surprise medical bills. As the session comes to a close, these final decisions will shape healthcare access, affordability, and outcomes for Georgians in the year ahead. Read our full Week 11 legislative update at healthyfuturegA.org/blog.